Welcome, everybody. We're just going to wait for 2 more minutes and until more people are coming in. If you have any questions, meanwhile, you can unmute yourself and ask me. So I hope everybody sees my screen. If you don't, please let me know because sometimes the technology doesn't cooperate. But if you do, we can just slowly move into the presentation. Today, we're going to talk about one of the most common condition that I see in my practice, which is autoimmune thyroid disease, specifically Hashimoto. And many people don't even know that they have Hashimoto because we know we can start diagnosing or bringing to patients awareness this process, this autoimmune process way before they manifest symptoms. So welcome. We're going to start this presentation. My name is Dr. Elena Klimenko. I am an internist and functional medicine practitioner in Midtown Manhattan, New York State. And today we're going to talk about sluggish thyroid. Can it be Hashimoto or can it be something else? So if you have any questions, we will have questions and answer session at the end of this presentation. It's going to be a pretty short presentation, but if you don't want to forget your question, please feel free to type it in their chat box of their screen. And I'm going to move my slides and please let me know if you cannot see them. So thyroid problems. Do you know that 90% of undiagnosed hypothyroid condition is actually related to autoimmune disorder called Hashimoto thyroiditis? So it is extremely common and it's getting more and more common, unfortunately. So today we're going to talk about what is Hashimoto and what are the symptoms, how does autoimmunity start, and what are their underlying condition that can potentiate or enhance this autoimmune imbalance. What are the common mistakes when people are diagnosed with Hashimoto? What are the treatment options? Of course, we're going to incorporate conventional treatment options as well as functional medicine. We're also going to talk about some of the new announcements in our practice. So understanding the thyroid, as you know probably that thyroid hormones affect virtually every cell in our body and therefore functioning of our body in general. So the low thyroid function slows the overall metabolic rate of the body. Therefore, we feel cold or we gain weight. And when your thyroid function is compromised, it's not just stays in isolation. It actually affects all other system in our body, not just endocrine, because thyroid is intimately connected to our adrenals and the cortisol level, but also in our metabolism, how we lose weight, gain weight, how we generate energy, because thyroid is responsible for thermogenesis. It also affects cardiovascular system, musculoskeletal issues, psychological and mental health. We know that from the studies when their scientists compared all available antidepressants and along with their thyroid medication, and guess what? People who were on thyroid medications felt better than on any other SSRIs that were tested. It also affects our skin, our hair and nails. So our beauty and our longevity and our youthfulness also depends on our thyroid function. So in order for us to understand how thyroid is working, I can just make my computer work and move the slides. me 1 second. Wonder Mercury's in retrograde and the slides are not moving, but hopefully it will be better now. And please let me know if you don't see my slides. I will correct that. Just unmute and let me know because I might not see your comments. Okay. I hope you can see it now. So we talked about hair, nails, and skin, which is so important. But this is just their schematic representation of what is thyroid. We all know this is the gland, the butterfly-shaped gland in the neck, and it produces the T4 hormone. So the T4 is not actually active hormone. It has to be activated in the blood to T3, which is the active hormone. Sometimes this path actually takes to the reverse T3, which is inactive hormone. The problem is both of those, reverse T3 and active T3, occupy the same receptor on the cell, except that T3 does the job and activates the variety of the processes within the cell. But reverse T3 is like a decoy. It just sits there and puts the brake on the thyroid function. It does not allow T3 to get in to the cell or connect to the binding site, and it does not start the processes that are responsible for the effect of the T3. And here, as you can see, the factors that inhibit the production of thyroid hormone, things like stress, exposure to the halides other than iodine, things like fluoride, make you think about fluoride in the water and fluoride in your toothpaste. Bromide, which is widely used as a caking agent in the bread, and it's a flame retardant that we can encounter, and it can absorb through the skin if through the new fabric or new upholstery. Toxins, things like pesticides, mercury, lead, toxic metals, autoimmunity, again, nutrient deficiency, oxidative stress, all those factors would put the brake on the thyroid production. We're talking about T4. But now we need to also understand that what can increase the production of reverse T3 is also stress, inflammatory imbalances, toxins, liver and kidney diseases, as well as infections. So factors that increase production of thyroid hormone is, of course, the key nutrients. Basically, we always want our nutrients to be balanced and at least not to be deficient, because if body has those nutrients, they're like building blocks. It can handle a lot. It can handle stress. It can provide sufficient resilience in the time of the stress, either it's infection or emotional stress. And therefore, this is where your foundation is your diet, how much nutrients you actually consume and how much you can assimilate. So further, you can understand that the factors that increase conversion of T4 to T3 are things like selenium, zinc, vitamin A, and vitamin E. Again, we're talking about our nutrients. That's how it's important. So also, it's important to understand that factors that can improve cellular sensitivity to thyroid hormones are also nutrients, vitamin A, zinc, as well as your physical activity. So this is their how thyroid functions. And now we're going to say, okay, so what is Hashimoto thyroiditis? So Hashimoto thyroiditis is the autoimmune condition where the immune system gets into the imbalance and starts attacking the thyroid gland as though it is a foreign invader. There's a specialized immune cells, we call them T cells, that produce antibodies, and these antibodies start attacking the thyroid gland, slowly destroying it over time. As a result, the thyroid function slowly decreasing, leaving patient feeling unwell with the common symptoms of hypothyroid. So you probably know, or maybe not, that Hashimoto versus regular hypothyroidism are the two different conditions. They both cause low thyroid hormones. But Hashimoto, as I mentioned, is an autoimmune disease that causes the immune system to attack the thyroid gland. But the regular hypothyroidism is the dysfunction of the thyroid gland to produce the hormone. And it could be for the variety reason that we just discussed in the previous page, mostly related to either not enough signal from the brain to the thyroid to generate thyroid hormone, or the lack of nutrients that will facilitate production of the good quality thyroid hormone, as well as the conversion of T4 inactive to T3, which is active hormone. So both types of the low thyroid conditions often feel the same, meaning the symptoms are the same. However, it's important to understand that the treatment is different depending on which type of the thyroid dysfunction the patients have. So the common symptoms of the Hashimoto as well as the hypothyroidism are pretty common. People will feel, well, they notice that they're gaining weight. They might be more constipated, more cold intolerant, so they feel always cold. They have dry, brittle hair or hair loss. They might feel depressed or just blasé. They feel like nothing is really motivate them. They have a decreased libido. Women might have experienced fertility challenges, and of course, the dry skin. But honestly, the list can go on. So there's many symptoms. I've seen patients with their cardiac arrhythmias because of their Hashimoto, and along with this list. So that's why a proper thyroid testing is really important. So how did it happen to the patients? So why would they get autoimmune disorder Hashimoto? So Hashimoto antibodies actually could be detected way before the symptoms start. That's why it's important to screen people for that and act early. So 10 years, if you identify that we identify the patient have antibodies, we can start educating them and hopefully reverse this process of thyroid destruction. So patients will not feel problems until they have enough tissue destroyed or damaged to create the symptoms, meaning that thyroid gland is destroyed on microscopic level and it cannot produce sufficient amount of thyroid hormone T4 in order to support necessary bodily function. There's a three main elements to developing Hashimoto thyroiditis. Of course, there's a genetic predisposition, there's environment and triggers, and there's an intestinal permeability. Well, the first two, of course, is easy, right? Patients usually come and they say, oh, my mom has an autoimmune condition, she has a thyroid, my dad has a Crohn's disease, and well, that's a genetic predisposition. It doesn't mean that we cannot control the autoimmunity if people have genetic predisposition. So, it's just more common that they will develop it. They might develop it now, or they might develop it in their end of their lives. So what we can do with this genetic predisposition is very important. Of course, environmental triggers like infections, always there, infections. Those chronic infections that can trick our immune system to develop wrong antibodies. Especially now, we see a boom or bloom of autoimmune conditions after the pandemic. The stressful events is another big environmental triggers of extreme hormonal changes like a childbirth or menopause can be also another trigger. And of course, we live in the toxic soup. We all know about this. We talked about it. We talk about detoxification, how important it is, because if we accumulate that environmental burden, our immune system stop working, functioning properly. And of course, intestinal permeability or leaky gut, something that probably not everybody understand, know. And I would like to just say a few words that leaky gut is the condition where the barrier of your intestines is compromised. And it creates the gaps between their cells that coat your intestinal lining. And when it's normally supposed to be very tight. Like in this picture, you can see that this connection between the cells are very tight. And this is a healthy gut lining. So when the connections between the cells is broken or compromised, that allows for the large proteins and molecules that are not digested properly will go through this path, through the tissue, into the bloodstream. And when they're supposed to stay within the lumen of the intestine, now they end up in the bloodstream. And that starts the whole array of reaction of your immune system, because immune system not supposed to see these large articles. So immune system starts attacking these larger proteins. And the problem is that the body tissue cannot really, sometimes can look very similar as those large protein that are non-digested. So they're similar enough that your immune system can actually start attacking your own tissue. So we call it molecular mimicry. When the pieces of proteins, large proteins that are, you can see right here in this picture, start penetrating, or it could be a microbes too. These little single cell parasites can also leak through the damaged gastrointestinal lining. They end up in the blood, and they end up stimulating your immune system to produce antibodies. But those antibodies look exactly like a thyroid tissue. So in some people, this is what triggers the immune system to start making antibodies to the thyroid tissue. So this is the molecular mimicry mechanism that always present, or very often present. And of course, we're allowed to have more than just leaky gut. We're allowed to have genetic predisposition, plus environmental factors, plus this leaky gut condition or process that we all get. But the problem is, for some people, it lasts only for an hour. For other people, it lasts for months and years. So how do you know if this is you? Do you have a Hashimoto thyroiditis? When you go to your primary care doctor, they will usually do a proper job and they'll check your thyroid stimulating hormone, or TSH, which is the signal from the brain to the thyroid to produce a thyroid hormone, T4. But it's not often enough. And it's all, but that's only marker sometimes conventional doctors use for many reasons. Training, coverage by insurance, not familiar with the new literature, but I see more and more advanced primary care who test more, which is very, very nice to see. A functional medicine panel that we do in our office, we check 6 different, or actually more than 6 markers. We look not only at the signal from the brain to the thyroid in the form of TSH, but we also look at the actual hormones. We look at the free T4, free T3, which is, remember, an active hormone. Then we look at the reverse T3, because if reverse T3 is high, we know that the cell does not get enough impulse or stimulation from T3. And then, of course, we love to measure antibodies, because if we find them, we can start the process of educating the patients to prevent their hypothyroidism to develop down the line. So variety of the antibodies, the most common are TPO antibodies and thyroglobulin antibodies. So by definition, autoantibodies, or the antibodies that your own immune system produces against the thyroid tissue, are necessary for diagnosis of Hashimoto disease, because it is an autoimmune condition. So what are the treatment options of a Hashimoto? The traditional conventional treatment is, of course, to give you synthetic T4, which is bioidentical, but it's T4, or levothyroxine or Synthroid. Synthroid is a brand name, levothyroxine a generic name, but it's T4. Remember, it has to be converted to T3, and it's nutritionally dependent process. So some people will not be able to break down T4 to T3. So when the doctors measure just TSH or just T4 and they don't look at T3, they really don't know if this thyroid is working, or this Synthroid or levothyroxine are working or not. So it's really important to do the proper monitoring. So in functional medicine, we're not just doing that, but we're also looking at the lifestyle, because remember, we're trying to reverse their triggers that led person to their autoimmunity to begin with. So we're looking at the lifestyle, how they sleep, what they eat, what is their stress level, do they exercise? Because remember, exercise will optimize the work of T3. Do they have a leaky gut? Do we need to turn it off in order to cool off the immune system response? We're also addressing inflammation. We're addressing detoxification needs. And lately, we've been addressing genetic factors that can predispose person for the autoimmune diseases. We, of course, prescribe pharmaceutical medications as the last resort, but we sometimes prescribe not just T4, but also T3. Sometimes people need just T3. I often see patients with the chronic infections like Lyme or mold. Their endocrine system is so taxed that they just need a little boost of T3. So they will start these patients on just T3 alone and very low dose, and then they feel like they have more energy to rejuvenate or regenerate their tissue. So we do support thyroid function with medication, but also with the supplements that can improve not only release of T4, but also conversion of T4 to T3 and improve sensitivity of the cells to T3 hormone. So let's talk about the typical case. Usually, as you probably know, majority of patients with hypothyroidism are women. And the typical woman is the woman in the middle age. And this is Melissa. She's 41, and her symptoms started after she had a child. Very typical story. She had a child in her late 30s. Of course, her primary care checked her thyroid. She started gaining weight. She got a little constipated, a little depressed. Her TSH was high, and T4 was low. T4 was low as well. And she started on the Synthroid, which is a synthetic T4, and every year since her late 30s, she would go and she would just bump the dose, bump the dose, bump the dose. But she didn't feel any better, and her symptoms did not resolve. So she came to me saying that, I'm tired of just increasing my dose of thyroid medication. I need to get to the bottom of it. What is going on? Why my medications are not working? So we created a personal health plan for her. We did the comprehensive testing to diagnose her condition, looking specifically for antibodies and the full thyroid panel, which she did have Hashimoto thyroiditis. We also looked at her stool test to look at what is going on in her gut level. And of course, she had digestive issues. She was constipated, but also she had elevated markers of leaky gut. She also was very stressed. She had a lot of nutritional deficiencies or insufficiencies. As you probably remember, the difference between those, deficiency is when you're outside of range of their normal, right? But insufficiency is when you're outside of the range of optimal, which is one standard deviation from the median. So we helped her implement all those changes, because we do have, not just me, but we have health coaches who work with the patients, and they help them to implement all those step-by-step recommendations with the diet, with the lifestyle, with exercise program, with the supplements. So we help her to implement all those changes based on the personalized needs and lifestyle and situation. So it's very personalized. So once her stress level and digestive issues were resolved and we healed her leaky gut, her medication dose was actually reduced and stabilized, and she started working, and she is still in the same level of the thyroid hormone. She basically worked with our practice for 18 months to put the autoimmunity into remission and to reduce the thyroid destruction, because that's the key. We cannot take her off the thyroid medication because her thyroid gland, unfortunately, was already destroyed to the point where she needs that lacking thyroid hormone. But we don't want to make the rest of your thyroid gland to be too lazy. So we want to supplement just enough for her thyroid gland to continue function. Because more you give, more suppression you create for her own thyroid gland to produce the hormone. So remember, if you have autoimmunity once, you cannot be cured, but you can put that autoimmunity into remission and stop the destruction of their targeted organ. In this case, it is a thyroid. In case of other autoimmune condition, you can put their autoimmunity into remission, and that's possible. It takes a little work, it takes guidance, it does take lifestyle changes, the way we eat, the way we sleep, the way we live our lives, but it's possible. So this is what we do in our paid practice. We help people to go through this program. I do the initial evaluation, which takes about 90 minutes to go through the full evaluation. Then the patient will get a customized plan. The patient will work with the health coach and myself to implement those recommendations. And then we meet for follow-up. After the follow-up, we kind of develop another step in the treatment plan. Patients do get a chance to meet in the group meetings with the health coaches, as well as with the health coaches individually. So this is how we practice functional medicine. If you have our autoimmune Hashimoto thyroiditis, I strongly recommend you to find a functional medicine practitioner who you feel comfortable with. You can go to their website of my alma mater, Institute for Functional Medicine, ifm.org, and find a practitioner near you. But if you would like to become a patient of our practice, take a next step. Schedule a discovery call with one of my patient staff. It's free. Or you can call their office and schedule an appointment, or just get more information. If you want to stay in touch with us and follow all the news that are happening in the practice, you can follow us on Instagram or sign up for the newsletter. Here's a QR code that you can scan and get on board with us. And as a thank you for today, you can enjoy this 15% off for the Detox and Power Duo. This is my two favorite products. First is the Powerhouse Multi, which is a great multivitamin, and Advanced Detoxification Liver and GI Support, which used to be Best Breakfast Advanced Detox. Great protein shake, gives you 24 grams of protein in one serving. I had it this morning, and I feel really energized and strong without even having just a snack. And it was good 9 hours ago. So that's a really powerful, nutritionally loaded product. So strongly recommend if you're looking for a multifactorial product that not just help you to detox from environmental pollutions, but also will help your gut and liver function better. And then there's, of course, Sunshine Wellness Trio. There also, you'll get a discount if you order this on our website, on our e-store. Great 3 products to get you from the summer to their fall and winter. Make sure your vitamin D level is up and test it. There's only one way to find out if your vitamin D is adequate. It's through the testing. Remember, their optimal level is between 50 and 80, not 30, not 40. If you have autoimmune condition, I teach my patients all the time, your vitamin D level should be close to 80. Vitamin D is immunomodulator. It will help to regulate your immune system so it's not attacking your own tissue. So excellent, excellent product. And I like the vitamin D3 1000, which is just D3 without K, vitamin K. And it's great for children because it's 1 drop, 1000. So when you need to load kiddos with the vitamin D because they gonna get exposed to all the peers in school, all the sniffles, all the upper respiratory infection, they're gonna bring it home, and you want to keep them protected so they don't get sick too often, because if they're sick, we have to stay home too. So vitamin D3, 1000, great for kids, but also for all the other family members. There's another great product, combination of products, your B vitamins, your methylated B vitamins, your glutathione precursor, which is great for the detox, and super omega-3, which is a triple power fish oil, omega-3 fatty acid, to keep the inflammation low. Inflammation where? Everywhere, in your gut, in your vessels, in your joints. 1 capsule equals 3 capsules. Excellent product to keep your omega-3, omega-6 ratio in the right place. And of course, if you're interested to learn more about the healing power of the gut and this incredible organ that we have, our gastrointestinal tract, with 70% of immunity located right there. If you want to understand the intricacies of gastrointestinal tract and effect of it on the entire biological system of our body, this is a great program. It's a digital program. You can watch it with your family. You can watch it alone. You can watch it at any time of the day. Please consider to getting it. And because you're here today, you can get a discount to get it as well. Just scroll, you can scan this QR code to get it $50 off. And we actually now offering 2 different ways to work with us. If you're not ready, for example, to work one-on-one with our practitioners, myself or another practitioner that we have in practice, you can just get this program, Whole Gut Wellness Program, learn it, do it yourself, and it's gonna cost you only $99. Great start. If that is not gonna resolve your issues to address leaky gut and address the gastrointestinal wellness, then you can consider their one-on-one consultation with one of us. But the Whole Gut Wellness Program with their health coaches is another option where you can meet with a health coach every week and get more guidance than just do it yourself. So those 2 options are outlined here. And here, if you scan this QR code, you will also get this on their separate page. So you can sign up if you're interested. So yes, this is their excellent program. If you want to join us for our broadcast channel, also you can scan this QR code. And remember, we offer IV therapy, which is really making people feel unstoppable and helps people to recover from illnesses, from jet lag, from just feeling sluggish. Excellent way to support your nutritional needs, bypassing your gut, but just going straight into their tissue. Excellent modality. We do IVs, not only with vitamin C and B vitamins, but also with choline, which is one of their key ingredient of the cellular membrane. Because without properly functioning cellular membrane, no matter how much thyroid hormones you're going to take, it's not going to work, because the cellular membrane is polluted by toxins. So we need to do this detoxification of cellular membrane, or the process of the membrane exchange, and everybody can benefit from it, especially living in our toxic world. For those of the patients who are present here, hi, thanks for joining. You know, and you did probably a 3x4 genetic test that tells me and tells you what you need to pay attention to. So as our patient, you can attend for free after you order this test through us. And there's a monthly group sessions that we run. It's usually on Mondays, either 3rd or 4th Monday of the month, This is not a correct day, so please take a note of it. It's not August 18. It's going to be a last Monday of the month. So please call our office or shoot us a portal message so we can send you a link. But this is a great way to look at those pathways and see, do I have a genetic predisposition for autoimmunity? Is the inflammation a big part of my genetics? What can you do to counteract that? All of that can be discussed, and it's completely free attendance for our patients. Also for people, unfortunately, we hear more and more about mold. As you know, mold is becoming a big problem in our environment. We run a free session for mold and toxin, how to heal yourself and how to heal your home. Feel free to join us on Tuesday, August 26th at 4 p.m. Contact our office. And if you are not in New York, but you're in Miami or you're in Florida, just want to let you know that I am seeing patients there now once every 2-3 months. So we are now have a footprint in Sunny Isles, northern Miami. So if you're interested, feel free to call us and let us know so we can sign you up. Or if you have friends who live in Miami and they want to have a good doctor, because friends want friends to go to the best doctors. And we help so many patients in a very profound way, something much deeper than just their 15 minutes physical. And if you're sincerely interested and enthusiastic about your own health, you probably want to have a functional medicine doctor, because we'll talk about lifestyle and diet and scientific supplementation tailored towards your own genetic needs. Who else can do that for you? Only functional medicine. So feel free to scan this QR code if you're interested and send a gift of wellness to your friend. And I want to thank everybody before we going into their live, the question and answer session. I want to extend my appreciation for you to join today. And please write down this code for 10% off on our e-store. This is their, you can find this e-store either by writing down this link or just going to my website, drelenaKlimenko.com, and clicking on the store, and you'll end up there. So use 10% off. And I really, really appreciate that you are all here today.